Hi, my name's Sarah. I'm the speech therapy supervisor, and I just wanted to talk to you guys today about our water protocol and the importance of oral care in the implementation of the water protocol. The water protocol is something that we implement that allows patients to have thin water either between meals or when they are completely NPO. So the guidelines of a free water protocol allows patients to have water between meals or if they're NPO. Oral care must be done prior to consuming any water, and patients should always be sitting upright, alert, and following commands in order to participate in a free water protocol. Not all patients are going to be appropriate, but a lot of our patients can really benefit from having water in between meals or when they are completely NPO. The research that is crucial to the water protocol shows us that oral hygiene is crucial. We have to get rid of that bacteria in the mouth. Water that is aspirated into the lungs is reabsorbed into the bloodstream and doesn't pose a risk of pneumonia. It's when the bacteria from the mouth goes down with the water that we really run a risk of increasing pulmonary compromise. So allowing a patient to have a free water decreases the risk of dehydration and really increases patient comfort. The most important part of a free water protocol is the oral hygiene component. So the first thing you want to do is make sure that your patient is sitting all the way up 90 degrees as much as possible. Sometimes with these beds, I'll even tilt the bed a little bit in order to achieve full upright position. This is important in making sure that the chemicals that we're using to clean the mouth aren't aspirated into the lungs. You're going to use suction and these swabs that are found in our supply rooms. The other component that you'll need is a toothbrush. I like to start with the swabs to remove any debris, get things loosened up. And what you're going to do is pop the container like that so the liquid goes into the bottom of the bag. Then you can open it, insert the suction onto the end of the suction tubing, and then you have it just like this. And then, get on there. While you're suctioning the mouth, you're going to want to place your thumb over this hole to make sure that you're getting good suction here. And then when you're completing oral care, you want to clean the entire mouth. So the tongue, the teeth, the cheeks, the inside of the lips, and especially the roof of the mouth. Suction as you're removing debris and loosening things up. Once you get things nice and moist, you can use your toothbrush. A lot of times I'll switch back to just the plain yonker on the end of suction and brush and suction simultaneously so I can suck out any extra moisture or any debris that I loosen as I'm brushing. Once all the surfaces of the mouth are clean, you can switch back to your suction swabs to clear out any extra debris, toothpaste, or solution that's still left in the mouth. So once you're done, it should be free of any plaque buildup, debris, and most importantly, all the oral bacteria that could be potentially aspirated down into the lungs and cause an pulmonary infection. One of the most important elements of this process is using the toothbrush. A lot of times we see these guys everywhere. They're the most readily available thing that we have to use. I can't tell you how many times I've seen these put in cups and water at the bedside. That's just a breeding ground for bacteria. These are one and done. You want to use these one time and throw them away. The toothbrush is crucial because what it does is it breaks down that dense biofilm that builds in the mouth when we're NPO, when we're on new medications, when we're stressed. All of these elements can help to create this dense biofilm, and that's where that bacteria just flourishes. So the toothbrush is especially important for breaking that down and removing it. For patients that are NPO, oral care should be provided every 4 hours. For patients that are eating and drinking, before and after meals. Another thing to consider are patients that have dentures. A lot of our patients wear dentures. Dentures should be removed and cleaned in the same process that you clean the patient's mouth. It should be free of any old adhesive, and all the surfaces should be brushed with a toothbrush to remove bacteria. If the patient's dentures aren't fitting well, if they're loose, they they could pose a bigger threat of decreased mastication and aspiration. So if they're not fitting well, it's safer to just leave those out. So implementing a free water protocol in the setting of good oral care does not increase the risk of aspiration pneumonia. There's been a lot of new research that shows that this can only improve quality of life and decrease the risk of pulmonary compromise, which could lengthen the patient's hospital stay.